Hello everyone, here is Dr. Molinari, and in this video I'm going to talk about hair transplant. So what are we going to cover in this video? What a hair transplant is, the main technique, how surgeon plans the natural hairline, step by step of the surgery, recovery timeline, risk limitation and common misconception. This is a very important part, complementary treatments. So, what is hair transplants? What the surgeon does? So, the surgeon takes the hair in the back part of your hair, so in the back part of your head, and move this hair, transplanting this hair in the front area. So, what doesn't create a new hair, as we can read, doesn't it distributes permanently hair, use follicular units. It depends on the technique. So the goal is a natural hairline. So most of the time, also sometimes in Turkey, I saw a lot of hairline that are straight. I think this is horrible and work best. Of course, we need medical therapy. So which are the main technique to transplant? FUT, FUE, DHI. So we need to understand that the surgeon should choose which technique, and the technique it depends on the patient. So we start with FUT. So what is FUT? In FUT we are going to take a strip of hair in the back, so in the donor part of your head, that is the back part of your head, and we are going to magnification with a microscope, so we are going to see your hair, and we are going to implant your hair in the front part of your head. So what we need to understand that this therapy leaves this treatment, this surgeon of course leaves a linear scar on the back of your head. So usually it's not visible because the hair, when the hair grow up, it will cover your scar. And the other part, very important, is faster than FUI. What is FUI? So FUI, we use these tools that extract units of hair, follicular units. So what the point? We don't have the linear scar. We have, of course, individual follicular is lower than FUT. Of course, there is also a part of magnification to see the hair, the bulb, and we have also a risk of overestimate. So it's not performed, of course, if it's not performed carefully. Ideal for patients that need modern graft numbers. So in the FUT, what we need to think that usually this kind of technique is used when we have to cover a lot of area that need to receive hair. DHI. So DHI, I think right now is the most famous technique. So we are going to take is very similar to FUE. We are going to take only one bulb 4 times, so it's more precise, but it lead also as well lead to a scar in the donor hair, but it's like a tiny dot, so it's not visible. Usually most of the surgeons use this technique and FUE. So how should be the natural hairline design? So based on the age, facial proportion, and future hair loss. So it's very important. If you decide to have a hair transplant, you need to take medication because the new hair, so the hair that are transplant, they are not going to fall, but your native hair, they can fall. So you need to take medication for saving your native hair in the area, irregularity and micro zigzag. So if you are seeing a guy that doesn't have hair transplant, you are going to see the hairline, and the hairline you can see that there are some irregularities. So we can recreate this irregularity with micro zigzagging. Of course, single hair graft placed in the front row, so What does it mean using DHI in the fourth in the hairline? Why this? Because naturally, a guy has 60 up to 100 hair for square centimeter. Usually in the transplant, we can transplant for square centimeter, usually around 50. So I think it's a good result if it is between 50 to 70. Of course, must match the patient ethnicity and depends on the donor area. So step by step, there is a preparation. So the scalp is clean, trimmed. So in some clinic, you can choose to have trimmed hair, or you can take your hair and trim it only the donor hair. I suggest to you to trim all the head because usually you can have a better result from your transplant because the surgeon sees better your head. Of course, marked area and local anesthesia. So it's not a general anesthesia, but a local anesthesia. Extraction, of course, with the different technique I showed before. Graft preservation. Follicular units are stored in controlled solution to maintain viability. Or, of course, recipient site creation. So microchannel are made with precise angles and direction. Also, the angle and direction of the new heart that are transplant are very important. Implantation, and of course, the final check. So, which are the risks? Of course, is a surgery, so you can have all the risk of a surgery, swelling and temporary redness, of course, folliculitis or infection, shock loss, and rare complication. You can have a scarring, so this hair transplant can lead to a scarring alopecia, and you can have also necrosis. The limitation, of course, donor area is finite and cannot be regenerated, so its permanent density, of course, will never match natural teenage density, as I told you before. Multiple session, it depends on how large is the receiving area, and result depend heavily on surgeon skill and planning and on your skin. Common misconception: a transplant stop hair loss. That's false. So you need medical therapy. And I told about the medical therapy in the previous video, so go to watch it if you're curious. It works for everyone, not true. Some patterns of donors are not suitable. It gives instant results. You need time, between 6 to 12 months, to see the real result. FUI leaves no scars. It leaves tiny dot scare, just less visible, as I told you before. So, which are the complementary treatment? Minoxidil, finasteride, of course essential to protect native hair over time, PRP, low-level laser therapy, lifestyle and scalp care. So for today is all. Thank you for watching. See you soon from Dr. Molinari.